Hi everyone. Today we're going to present our project on COVID-19 intelligent forecasting. First of all, please let me briefly introduce our team. All of us are come from the quantitative methods of social sciences from GSAS, and this is a project that we finished in our practicum courses. Go. We all know COVID-19 has impacted businesses, economy, and society and changed the way that people live. So this project entails COVID-19 prediction for the 50 biggest cities and 50 states across the US with a tailored forecasting model of each region that has regional wave detection, clustering, and a mobility forecasting model. And at last, we come up with an interactive website with visualizations so that companies, governments, and general audience can easily understand the pandemic of their region with the website. We believe that this serves public good, better understanding of how to navigate these difficult times, for safety reopening, saving businesses, and safety for all.
We use 4 data sets to power our model. COVID-19 case and death data comes from Johns Hopkins University, government policy response data comes from Oxford, population data comes from the US Census, and mobility data comes from Google. At the heart of our model is the reported death data, which we feed into our SEIR simulator with a machine learning layer to generate forecasts. The SEIR model is a widely used and proven compartmental model, which approximates how an infectious disease spreads across a population. SEINR refers to a different state a person in the population can be in with respect to the virus. So for example, somebody might move from susceptible to exposed to infected and ultimately to either recovered or dead. Using this, along with the reported death data, allows us to search for the best parameters, such as the rate of spread and the death rate, for a region over a given period of time. Once we've learned these parameters, we can then generate future forecasts using our SEIR model. However, there are 3 major challenges to this approach. First, these models are extremely sensitive to the initial parameters, and these parameters vary across both second, region, and third time.
So in order to overcome these challenges, we devised 3 solutions. First is city-level splits to overcome regional differences. We have found out that cities handle COVID-19 better. So by splitting the cities from rest of the state, the model is more reflective of the reality. Second is automated wave detection to overcome the influence of time. Each area went through multiple waves of the pandemic. Our method automatically detects the start and end dates of a particular pandemic so that we can find tailored parameters that optimize each wave of the model. Third is clustering to overcome long-term prediction uncertainty. Our model tries to create a long-term prediction which causes different problems. By clustering how each state and city is handling the virus, we found ways to overcome these prediction uncertainties. So each city or a state would either be in elimination, suppression, mitigation, controlled spread, and uncontrolled spread. That helps us to understand which parameters to fit for long-term forecasting.
A key point of our project was to make this data accessible to people from all types of backgrounds, technical and non-technical. So we built an interactive dashboard so that potential clients can interact with the historical data and predictions of COVID-19 deaths and mobility. This is a targeted way that helps them understand the situation and the trajectory of the pandemic situation, because individual case numbers wouldn't provide as much of an insight. In addition, the dashboard is especially useful, as you can see here, when comparing between states. Imagine you're a potential client with businesses and outlets in several parts of US. So with this graph, you can select different states to view and compare the historical, current, and predicted situation. It can thus help you make a decision on where you want to continue, cease, or perhaps increase operations.
In addition to what's been covered here, we also generated additional models for mobility in major areas such as retail, businesses, pharmacies, and groceries. We hope our combination of models and findings would make it easier for the reopening for each of the locations we covered. We want to thank the KPMG team, the judges, and the audience for your time and for your attention.